A shadow emerges, the genesis of the 1918 influenza. The year 1918 dawned like any other, but a silent threat lurked on the horizon. The world was at war, but a different kind of battle was about to begin. It started subtly, a whisper of illness in crowded military camps and bustling cities. This was no ordinary flu. It was a novel strain of influenza. The exact origins of the 1918 influenza remain a mystery. Some scientists believe it emerged from China, while others point to the United States. Regardless of its birthplace, this new virus spread and mutated, quickly evolving into a global threat. The first wave in the spring of 1918 was relatively mild. People experienced typical flu symptoms and most recovered quickly. This initial wave lulled many into a false sense of security. Little did they know the virus was mutating, becoming more contagious. By the fall of 1918, a second, deadlier wave swept across the globe. This time the virus attacked with a vengeance, leaving a trail of death and devastation. A world engulfed. The unstoppable march of the Spanish flu. The 1918 influenza pandemic, often called the Spanish flu, earned its name not because it originated in Spain but because Spain, a neutral country during World War I, reported on the virus's severity openly. Spanish newspapers provided detailed accounts, leading to the misconception that Spain was the epicenter. The virus spread like wildfire, ignoring geographical boundaries. Facilitated by global travel and wartime troop movements, it reached every corner of the globe. Entire communities were decimated, with death rates soaring. Hospitals overflowed, and mass graves became a grim necessity. The virus affected all ages, but young adults were particularly susceptible. What should have been a time of vitality became a season of loss and grief. Scars on society, the pandemic's profound impact. The 1918 influenza pandemic left an indelible mark on society, its impact extending far beyond the staggering death toll. The very fabric of communities was torn apart as families were fractured by loss, businesses shuttered, and schools and churches forced to close. Fear and uncertainty were pervasive, casting a pall over everyday life. People were terrified of contracting the virus, of unknowingly spreading it to loved ones, and of the societal collapse they witnessed unfolding around them. The psychological toll of the pandemic was profound, leaving many with lasting trauma and anxiety. The pandemic exposed the fragility of healthcare systems worldwide. Hospitals, ill-equipped to handle the sheer volume of patients, were forced to turn away the sick and dying. Doctors and nurses, working tirelessly and often without adequate protection, succumbed to the virus themselves, further crippling the healthcare infrastructure. The pandemic also had a significant economic impact. Businesses closed, factories shut down, and global trade ground to a halt. The world, already reeling from the devastation of World War I, faced an economic crisis of unprecedented proportions. Section 4. A global struggle. Battling an invisible enemy. The 1918 influenza pandemic presented an unprecedented challenge to governments and communities worldwide. With limited scientific understanding of the virus and no effective treatments available, the response was often reactive, fragmented, and at times misguided. Public health measures, such as mask wearing, social distancing, and quarantines, were implemented with varying degrees of success. Some cities, like St. Louis, acted swiftly and decisively, implementing strict public health measures that helped to mitigate the impact of the virus. Others, slow to react, paid a heavy price. The lack of a coordinated global response hampered efforts to contain the spread of the virus. Countries focused on their own outbreaks and often reluctant to share information, missed opportunities to learn from each other's successes and failures. Despite the challenges, there were stories of resilience, compassion, and selflessness. Doctors, nurses, and other essential workers risked their lives to care for the sick. Communities rallied together, providing food and support to those in need. In the face of unimaginable adversity, the human spirit endured. Section 5. Whispers and outcries, the media's role in a time of crisis. The 1918 influenza pandemic highlighted the crucial role of media in shaping public perception and influencing behavior during a global health crisis. The media, encompassing newspapers, radio broadcasts, and word of mouth, became both a source of information and a breeding ground for misinformation. In the early days of the pandemic, information was often scarce and unreliable. Governments, eager to maintain morale during wartime, downplayed the severity of the outbreak, leading to confusion and mistrust. Newspapers, facing censorship and pressure to avoid inciting panic, often published sanitized accounts of the pandemic. As the death toll mounted, the media played a crucial role in disseminating public health advice, promoting preventative measures like mask wearing and social distancing. Public service announcements, printed in newspapers and broadcast over the radio, urged people to take precautions to protect themselves and others. However, the media also contributed to the spread of misinformation. Rumors and conspiracy theories, fueled by fear and uncertainty, spread like wildfire. Some claimed the pandemic was a form of biological warfare, while others blamed it on everything from enemy spies to divine retribution. Section 6, Truth Lost in Translation, Misinformation and Its Consequences. The 1918 influenza pandemic demonstrated the dangerous consequences of misinformation during a public health crisis. In an era before the internet and social media, rumors and false cures spread through word of mouth, newspapers, and even from the pulpit. Misinformation about the cause of the flu was rampant. Some believed it was caused by bad air, others by a particular alignment of the planets. These false beliefs led to ineffective preventative measures and in some cases even harmful practices. Quacks and charlatans peddled useless remedies, claiming to have found cures for the flu. People desperate for a miracle cure spent their dwindling savings on worthless potions and treatments, often delaying or foregoing legitimate medical care. The spread of misinformation undermined trust in public health authorities and fueled resistance to preventative measures. Some people, skeptical of official accounts, refused to wear masks or practice social distancing, contributing to the further spread of the virus. Section 7. Echoes of the Past. Lessons learned and the importance of preparedness. The 1918 influenza pandemic, a stark reminder of the vulnerability of humankind to infectious diseases, left an enduring legacy on global health. It underscored the critical importance of pandemic preparedness, scientific research and international cooperation in combating infectious diseases. One of the most important lessons learned from the 1918 pandemic was the need for early detection and rapid response. The virus's rapid spread highlighted the importance of robust surveillance systems, capable of identifying and tracking emerging infectious diseases. The pandemic also underscored the importance of scientific research and development. The lack of effective treatments and vaccines at the time highlighted the need for ongoing investment in infectious disease research, including the development of new antiviral drugs and vaccines. Perhaps the most enduring lesson of the 1918 influenza pandemic is the importance of international cooperation. The virus's global reach demonstrated that infectious diseases know no borders, and that a coordinated global response is essential to effectively combating them.